Hi, everyone. Welcome to this week's edition of This Week in Global Development. Today, I'm joined by our reporters, Alyssa and Sarah, who've been on the podcast quite a few times. Hi, guys. Thanks so much for joining me.
Hey, Remy.
Breaking news, exciting times. We've actually just published a story, I think like half an hour ago on this. So this is an exciting time to talk about this. The Gates Foundation came out with an announcement on their 25th anniversary. First, Bill Gates has committed to giving away nearly all his fortune to the Gates Foundation. The foundation will be closing in 20 years' time, and they are looking to spend all this money, which should amount to around 200 billion in 20 years' time. Alyssa, you just published a story on our website. If you're listening to this, check it out. She has all the details. What do we know so far?
Yeah, so huge news, like you said, Ruby, coming from the Gates Foundation this morning. I mean, to, headline it, Bill Gates is essentially contributing 99% of his personal fortune over the next 20 years to the foundation. Of course, the foundation has already become, over the last several years, last several decades, one of the biggest players in global health and in philanthropy. But now this latest donation, this latest contribution will surcharge that. In the press briefing, the organization's CEO, Mark Sussman, was really talking about kind of the place that we're at right now in the world, and with the changing nature of US aid, the UK government proposed cuts to French aid. It's really something that's going on across the world, and it seems like the Gates Foundation is trying to do what they can to offset some of that. This is kind of a massive amount of money that will be going to global health, specifically ending maternal and child health, preventing infectious disease, and poverty reduction through various different avenues. So that's where this money will be channeled in the next couple of years going forward.
I just wanted to add that one of the interesting aspects of it is that the foundation is now committing to spend its money more quickly. So the foundation will permanently close its doors at the end of 2045, which is several decades earlier than originally planned. So that's interesting as well. And one of the elements that that Bill Gates has emphasized is that the foundation is a very science-based entity, and it has really worked on R&D and kind of developing innovations, and it's worked on over 100 innovations and kind of working on the rollout of these in areas such as global health and vaccines, diagnostics, and whatnot. And that funding will go towards, in the global health space, in particular, kind of rolling out some of those innovations, but also the continuation of R&D moving forward.
I found that super interesting because basically what I'm reading from it is that their priorities are not necessarily changing, but they believe they can do what they want, what they set out to do quicker. And also, I found a little bit of optimism in the press release that they gave out, as well as interviews that Gates has done in relation to this. He talks about this moment that we're in time, reduced funding, we're seeing scale backs, and we're seeing people moving backwards. But he also says we can still do this within the next 20 years. We can still achieve what we set out to achieve within the next 20 years. And we're probably going to see a lot of rollbacks immediately because of the aid cuts that we're seeing, as well as other countries who are also saying they're probably going to spend less. But then overall, he sees progress within the next decade. He says within the first 25 years, we managed to halve childhood deaths, and it's possible to actually do that. Are you seeing this optimism as well from people within the foundation, Alyssa?
Yeah, I mean, I think it was a little bit of both, right, on the press release. I think there's a reality of this time that we're in, but also the fact that, we have the skills, we have the capabilities, and kind of looking past the last 25 years, I mean, the announcement does come on Gates's 25th birthday. And it comes, as many are gathering in New York to celebrate that landmark. And I think looking back at the work that the foundation has accomplished in the past, and then, like Sarah said, with that acceleration, what can be done going forward and in the future. Something that is interesting too is the fact that, like Sarah said, initially the Gates Foundation was planning to sunset 20 years after Gates's death. So, he's turning 70 this year. So he, who knows how long Bill Gates will live, but it is a significant shift and an acceleration.
Also, to add on that, I think Gates, in an interview on this announcement, he also discussed kind of, rich people will come, there will be rich people after me. And I think he's trying to inspire and kind of, solidify the philanthropic sector to care about these issues a bit more. One thing that he kind of has emphasized as well is that it's not necessarily that people don't care about things like vaccines in low and middle income countries, but there's a lot of countries and their governments under pressure, fiscal pressure, and you have to, if you have citizens that are, have high healthcare costs and whatnot, you do have to make up for that funding elsewhere. In the Trump administration cuts, there's been conversation from Bill Gates about, he sees kind of interruptions within the political cycle, but that doesn't mean that, funding couldn't be restored in a next term or in a next presidency. So, he's kind of emphasized that he believes in kind of the generosity of humankind and seeing that move forward.
And speaking of rich people, we've had this so many discussions around philanthropy and how it could possibly fill the gaps and whether they'll be able to actually possibly fill the gaps. And I think this is a good step, in terms of leadership. Do you think we're going to see more people coming out in support of development and aid from the philanthropic sector? And do you think we're going to be seeing more commitments?
Yeah,
and you have that pull.
Maybe even just taking a step back before answering that question, because gosh, I don't know. But something else that Suzman did say in the press briefing is philanthropy can't fill the gap, right? And despite the optimism that we just talked about, he was, kind of pretty clear about that. He said, even an organization like ours, with the funds like ours, with this new announcement, we're doing everything we can to offset that, were kind of his words. But at the same time, they're doing advocacy work and other kind of work behind the scenes to push governments to do things like fund Gavi and the Global Fund and these other avenues for a lot of incredible health work that's been going on over the past several years. But just noting kind of where we're at in this stage where governments are kind of the biggest players here, right? And they're the ones that are receding the most.
Also, just to pivot a little bit, one of the things that he's emphasized as well, the foundation has emphasized, is that it's artificial intelligence. And I do believe that kind of one of the things that they're signaling is that we're going to spend this money at a more rapid pace, but also in a more efficient manner. Kind of seeing AI play roles in healthcare, agriculture, and education, for example, in kind of more sophisticated diagnostics. And that was in the release that just came out today. That was emphasized more than once, that AI will play a significant role in this funding.
And also in terms of more efficient funding, one of the conversations that I find really interesting in the health space is that a lot of health experts say we don't actually need to fill the gap in its entirety. We need to do things a little bit more smarter, which is what I think the foundation is saying, that if we're able to leverage the money that we have and we're able to work smarter, then we should be able to accomplish more with less. Is that something you're also hearing, Sarah?
Yeah, absolutely. And that's been something we've reported on in recent months, is in particular vaccines. So the Gates Foundation is a big supporter of vaccines, and that's seen as one of the most effective health interventions, because essentially you're spending very little in the case of most routine vaccines to prevent horribly costly infectious diseases and whatnot. And so that has been advocated by a lot of people in recent months, that we really need to ensure that even if there is cuts around vaccines, that those are filled in some way, and that routine vaccination is supported globally.
And also, one other thing that I found interesting, and you mentioned, Sarah, support for these organizations such as Gavi and the Global Fund. I think one thing that I'll definitely be on the lookout for is what happens next, because it's been a tough fundraising environment for both these organizations and others. And you kind of had the sense that organizations were competing for funds. So it'll be interesting to note what commitments will come from the Gates in terms of these organizations. What are you on the lookout for, and what will you be following
yeah, I think just that, right? And seeing what happens next throughout the year, the reauthorizations and that kind of thing. I think there's also, from where I sit in Washington, D.C., a pullback and a pushback for many of those things, right? I mean, we can talk more, and I think we have on this podcast before about Gavi and the U.S. kind of retrenching from that. We've got quite a lot at play here and a lot at stake. I mean, if we look also just at the U.S. and looking at global health funding from that bilateral, government angle, huge cuts. I think we talked last week about the budgets that were going on. The budget proposal, let's say, hasn't been confirmed, and it hasn't been gone through Congress. But what President Trump wants to do with foreign aid in the coming year is massive cuts to global health, right? So those are kind of some of the things in terms of seeing how that shakes out, what Congress decides, and the U.S. kind of setting that pace for the rest of the world. We'll see.
Yeah, and also in your story, Alyssa, on the budget that came out on Friday, one of the aspects is, the cuts to PEPFAR, the President's Emergency Plan for AIDS Relief. One of the big questions is just, there's cutting certain elements of programs is really not effective in the long term. So if you're cutting areas like prevention for HIV and testing, that's hugely problematic to just, only fund antiretroviral drugs and not kind of this other element that was really helping bring down the caseloads globally.
Definitely, especially because there was a sentence in that budget that said, okay, well, PEPFAR, kind of the whole block of global health was really focused on family planning, kind of the criticism that a lot of global health work was funding abortions, which is not allowed under U.S. law. But that was the bulk of that paragraph. And then the last sentence was PEPFAR beneficiaries will continue to be supported, or I think the word was preserved. But like Sarah said, those beneficiaries are just and that doesn't include a child born with HIV tomorrow or someone who contracts the virus in next week. And it also doesn't include, or we're not sure if it includes testing or prevention or, supporting mothers to make sure that they don't transmit the virus to their babies. So lots of things kind of unknown right now. PEPFAR is, has a big bipartisan support within Congress, so we can expect some pushback. But still, it's a little bit of a complicated environment at the moment.
Speaking of the budget, I think it proposes almost like 80% cuts to aid. But there were some organizations that seemed to have support, and these, I thought, development banks seems to be winners within that budget. Can you explain to us what the budget says on development banks?
So the DFC is a winner within this proposed budget. Interestingly, the Millennium Challenge Corporation is not mentioned. I know this is kind of different and doesn't quite go in that regard, but it's a little bit unclear because I think people have been asking questions like, okay, if things don't come or they don't appear in the budget, does that mean they're cut? We just don't know at the moment. I don't think that it's safe to say that they are. Anyway, from what we do know, there's kind of these two pieces of the puzzle that are, let's say, the winners. So there's DFC, and then there's also International Development Association, so the World Bank's IDA. So that's kind of the World Bank's fund for the poorest countries, kind of which, in a surprise to everyone, the administration said that they intended to provide $3.2 billion to IDA. Now, that's lower than Biden had pledged $4 billion, but still, I mean, some people thought it would be carved out and cut out completely. So that was kind of seen as a win. Though other multilateral development banks did not fare as well. I believe, if I'm getting it right, the African Development Bank has an African Development Fund that supports the poorest countries, and it's also going through a replenishment. That was eliminated in this budget proposal. So the larger MDBs doing well, the ADB less so.
Yeah,
I also wanted to... Yeah, go ahead, Sarah.
Sorry. One thing that I also found interesting in your reporting, Alyssa, was that it created a new $2.9 billion America First Opportunity Fund, which kind of includes efforts to counter China's influence. And that funding, if I'm understanding correctly, would be used at the president's discretion, which was quite unusual.
Yeah. A really unusual piece of the puzzle here. In past leaked memos that have kind of circulated around Washington, there was a little bit more detail that was added. Again, this is not in the official, but this is something that we saw a couple weeks back. And an example that was listed there was support for a tuna treaty. So this is something that basically allows the U.S. to fish in the waters of other countries. So, not development. A lot of the kind of wording in the proposal says some things in the development and assistance buckets or the economic support buckets that are eliminated or shifted out may go into that America First Opportunity Fund. But kind of reading between the lines, it doesn't quite seem like the America First Opportunity Fund would be a home for development work. You're right, Sarah. It also is kind of discretionary spending. So it's meant to be, a pocket of money that the president can use to fulfill or to direct toward foreign policy and administration priorities. So I think from the folks that I've talked to, whether that will fly is a little bit unclear, because that would require Congress really kind of letting go in quite a large way, which we're not sure if they will be willing to do.
And I wanted to switch gears because another interesting story that we published this week, I think that was yesterday, was on defend the spend. And I found that super interesting. I think, first of all, Elisa, can you explain what is defend the spend and how is this affecting organizations who are expecting money from the US and who have waivers to continue aid work?
Yeah. So I spoke with someone yesterday who said that in one day they received 200 of these emails, like woke up and they had 200 emails from Defend the Spend at HHS.gov. HHS is the US government's Health and Human Services Department. So the reason that they're coming from that HHS.gov account is because they kind of all feed into the same payment system. So this means folks that were organizations that were trying to draw down funds at USAID, the CDC, the Centers for Disease Control, the National Institutes of Health, even the Department of Labor, there's some reporting on that. We're all getting these emails bouncing back to them saying, okay, great that you just requested a drawdown. We're going to need additional justification. And there's a couple of different things that they want that really kind of mimic what an invoice looks and feels like. Now, on the face of it, I think that's all well and good, right? Okay, well, why are you requesting money? Let's explain that. But if you look at aid, I mean, that all happens, just not right now. That all happens in the procurement process, right? So USAID has long been criticized for this like very, very long, complicated, drawn out in many ways process of how do we get our money to organizations? How do we decide how they're going to spend it? It's kind of line by line, right? In that process, in that budget process, in that proposal process. And doing this again for organizations, it's kind of a rehash and a system that they're not really set up to do. So you're having financial heads at different organizations having to go back to people that are on the ground and say, okay, but what exactly was this for? We need, invoices, receipts, we need vendor information, all these types of things that were already baked into the proposal. And it's all things that organizations say, we'll get it and we can figure it out, but it takes time. And it's again kind of contributing to this one. It's described as another piece of red tape on top of an already very kind of complicated bureaucratic system. And two, it's contributing to a slowdown where funds are already slowing down. And that's kind of the other really important piece of this puzzle, which is that over the past several weeks, there's been a pretty precipitous drop in the amount of money that the government has been supplying to folks that are drawing down funds. And remember, these are the few that are left standing, right? So we saw a call of thousands of programs at USAID in the State Department. At USAID, it was some 85%, right? So these are the ones that are remaining and have gone through that process, that foreign aid review, and that scrutiny from the government. So I think for a lot of people, I had someone say to me yesterday, someone else say, like, we feel like we're back in February, it's like round 2 of what we were going through initially. And just we're now again at the precipice of, we don't have any more cash. And it was coming in. So we rehired staff because we thought we had survived. One organization rehired 170 people. And then they started getting these defend the spend justifications and the cash stopped coming through. So they're like, we're going to have to terminate them again. That's not yet set in stone, but these are the thoughts that are going through organizations' minds right now.
A really tough environment because assuming all the programs that survived are expected to be life-saving programs, and you assume life-saving should be linked with urgency, and getting that money equates to getting aid out quickly, I assume. And I think a good example of the story of this is a story that we published on RUTFs. This is like a peanut paste, which is known as ready-to-use therapeutic food. And basically, we have 400,000 boxes of this stuff that's stuck in the US. And it's supposed to be going to places like Sudan. But companies that produce it are waiting for signatures to be able to transport or ship this food to the countries that need it. And they're on a time crunch, really like anxious, saying that if we don't get this food to the children that need it, we're going to start seeing people dying. So that sort of urgency is missing from that. And I think, Sarah, you've seen a lot of examples of this when you're talking to people who receive funding, and a lot of frustration, right?
Yeah, absolutely. And I think one of the interesting elements too of the last few months is kind of people have come to a better understanding of what the US government was providing globally. For instance, I had no idea that the USAID was once the world's biggest, or excuse me, funded half of the world's supply of the fortified pastes and RUTFs, and much of it was produced by two U.S.-based companies. And yeah, it's quite interesting. It's they're waiting on signatures that come from Jeremy Lewin, who is a Dodge staffer. And yeah, so it's put these companies in really precarious situations, and the funding came, or excuse me, the manufacturing of the peanut paste was through the Food for Peace program, which is a USAID administered program that works with the U.S. Department of Agriculture and produces food procured by U.S. farmers. So this also has a huge implication for American farmers as well.
And Elisa, under the proposed budget, Food for Peace doesn't survive, right? Am I correct?
Exactly. And this is another piece similar to PEPFAR where has had a lot of bipartisan support. I mean, in some ways, Food for Peace, and I think it's mentioned in Jesse's piece there, is it's been criticized in some regards because it requires buying from American farmers. Actually, it's surplus, right? So it's really kind of a net benefit for these folks in America's farm country because they're giving, they're able to sell that, is then bought by USAID, and then that is then distributed out to countries in need. Because of that, it's had quite a stronghold in many Republican states that have a lot of those farming communities. But yeah, in this particular budget proposal, Food for Peace would be zeroed out, and so would McGovern-Dole, which is another food program. So you've got kind of this real, conflicting issues here, right? Because you've got on one hand, you see these bipartisan supported programs. We're not sure if they'll make it through Congress, but on the other hand, you have what President Trump wants and says. So far, it seems like Republican lawmakers have gone a lot with what President Trump has proposed. So we'll see what happens. The RUTF piece of that is a really interesting one because, as Sarah mentioned, those are two American-based companies, again, sourcing from American farmers. So it's back to that kind of cycle of Americans and getting impacted by this foreign aid review and rescissions.
And I actually found it quite interesting. One of the companies mentioned that they actually had to set up an office in the US to comply with the request from USAID because they wanted to get surplus from US farmers. And yeah, but I wanted to switch gears because Sarah, you've been in this USAID cycle with us for quite some time, but you managed to take a little break and travel to Madagascar, where you were reporting on the country's efforts on polio eradication, which was really interesting, and also I think a good sort of time to step back and experience something different. So can you tell us about the trip and what you kind of saw in Madagascar?
Yeah, absolutely. And I think this plays into the Gates conversation as well, because the Gates Foundation has really prioritized the elimination of polio globally through financial and technical assistance through the Global Polio Eradication Initiative. But yes, they just got back from Madagascar yesterday, which is a beautiful and interesting country. And I was there to report on the country's recent polio outbreak and its response. So the country was declared polio-free in 2018, but then between 2020 and 2023, it experienced an outbreak where over 50 people were paralyzed, majority children. The government and its partners then responded with force, which included 7 dedicated polio campaigns across the country in recent years. And now there hasn't been a case since September 2023. So at Devex, we have a series on success stories in the health space. And so in this reporting, I'm documenting kind of what went into Madagascar's success in these campaigns. And the country has a lot of logistical challenges. And one of the main things that I heard when I was there was actually getting vaccines to reach very remote communities and very remote health clinics. And and ensuring that people actually come to these clinics or are reached by health workers. There's also some disinformation about vaccinations, kind of concerns around sterilization, and other things. There's really high levels of poverty and limited resources. But the strength of the polio campaigns just were really kind of the government taking a very clear ownership of it, and it kind of trickling down to the local level, and then the strong partnership of other international organizations like Gavi, UNICEF, WHO, Rotary International, and then the Global Polio Eradication Initiative, and then really kind of a reliance on health workers at the local level and community health volunteers. So kind of moving forward, there's not an active polio outbreak right now, so they're not doing those dedicated campaigns at the moment. So they're depending on routine vaccinations, and so I visited a number of those across the country, and that includes both parents bringing in their children to health facilities for those vaccines, but also outreach strategies for more kind of remote areas, and that includes mobile health clinics. So I was lucky to visit one of those. And then the country will have a big catch-up routine vaccination campaign in June, and that includes kind of the whole of routine vaccinations beyond polio. So international monitors are kind of in the process of assessing whether the country can again be considered polio-free once again. And while I was in the country, those teams were there as well. But there are also concerns about how the U.S. funding cuts might impact these gains in areas around surveillance and vaccination campaigns. So I'm writing a piece on these successes, but also kind of the challenges and fragility of the gains in the face of some of these limited resources.
Two things I love about that. I love the series because I think the environment that we're in right now as a community, we don't get a lot of success stories, and we were in such a precarious position that we're so focused on what's going wrong, and we don't get to really look at the success stories. So I really enjoy the series for that, because it gives us a chance to look at the success stories and also see what people can replicate. So I encourage you to look out for that story and look out for the rest of the series as well. A lot of interesting takeaways from there. And the other thing that I love is that Sarah does a lot of on the ground reporting, and I get to live vicariously through her. So you're going to see a lot of photos, a lot of videos, videos of Sarah's making her track down in these remote areas and following health workers, which is super, super exciting. Not sure I could pull it off, but I enjoy following Sarah and watching it through her eyes. So yeah, that's something to definitely, yeah.
I was just going to say, and Rumbi is my wonderful editor who makes sure that the piece comes together in good form.
Thank you. So definitely on the lookout for that. And then another thing that we're also on the lookout for the coming months is updates on the legal challenges to what's happening with the Trump administration's dismantling of U.S. aid. And I think we'll be expecting a story from you, Elisa, on that. Am I correct?
Yes, we're pulling together all the latest pieces. There's so many different lawsuits currently ongoing. Many of them are kind of in a pretty slow process right now. So we've got a number of, especially for the smaller organizations, where we're just waiting to hear from judges and what they're expecting. But there's a couple of big cases that are on the horizon too, and that are rapidly moving, and we're seeing kind of new documents every day. So expect something from us early next week, kind of tracking all those cases and seeing where we're at the moment.
Definitely lots to look forward to, and we'll also be on top of the Gates Foundation. We have a story out on our website right now, which will be updating, and there'll be lots more to come. So please sign up for our newswire, where we'll have lots of information. Our managing editor, Anna, is on the ground following the Gates story, so we'll have lots of information in tomorrow's newswire. But thank you, Elisa and Sarah, for joining me, and yeah.
Thank you, Rumbi. Thanks, Sarah.
Thank you both.